Good morning, everybody. Let's start on time. Today's topic is something new in our agenda, you know. It's health and climate change. As a physician, I would change it in a different sequence, the climate change and health. Because the climate change is inevitable, you know, it will happen and we have to adapt to that. And perhaps the goal of this panel is to find some answers, what we have to do to adapt to this possible damage to our health all over the planet. And we all know that there are emergencies coming more often than before. That means, you know, wildfires, heat strokes, and heat blows, and flooding, and all the stuff we have seen in recent years happening more often in definite places. To my mind, it's very important to understand that there is no the same geography all over the globe. We are very different regions with different climates, you know, and the effect of climate change in every region is different. So is healthcare system development is really correlated to the climate change? Yes and no. And I would have the opportunity to get the answers from the perfect panel. So we have a lot of questions which are on agenda and coming soon. So again, if the temperature rises in the lakes and rivers, at least for 1 degree, you know, the vegetation and also the microflora of the water inhabitants, you know, changes, you know, the patterns of the infectious diseases, how they behave in a new reality, you know, is a challenging question, you know. Something will change everywhere, but the most important value after our lives is our health status. And it is very different all over the world. From very sophisticated development healthcare systems to very poor healthcare systems, which are going to be changed for the better. And therefore, you know, I start our panel with giving the floor to Petar Stoyanov, the former president of Bulgaria.
Thank you very much, Chair. Okay. Let me start on a positive note. After decades of arguments on this topic, finally, the vast majority of people now realize that climate change poses a range of threats to human health and survival in many ways. The devastating fires in Los Angeles last week are an obvious proof for that. Of course, such impacts can be direct: forest fires, heat waves, storms, floodings, or drought, or indirect, through agricultural losses, economy, social structure, changing form of diseases, etc., etc. I'm sorry to switch off my mobile. No doubt, some population groups are particularly vulnerable to the health effects of climate change because of the socioeconomic inequalities in cultural, physiological factors. Whereas the poorest and most vulnerable communities are usually the first to be affected, the interconnected nature of climate systems, ecosystems, and global society shows that no one is immune. Let's mention again the current catastrophic events in some of the most expensive neighborhoods in the world. I mean, Los Angeles area. The magnitude and nature of health impacts from climate change cannot be predicted accurately. However, it is obvious they will not go away and they will continue to affect major aspects of our health. Recent data show that people all around the world are facing record-breaking threats to their health due to the rapidly changing climate. Of the 15 indicators monitoring health threats, which are related to climate change, 10 reach concerning new record values. And one of them impressed me very much because of my age. Heat-related mortality of people over 65 years has increased by 167% compared with the end of 90s. 167%. People are also increasingly at risk from life-threatening extreme weather events. During the last decade, 61% of the global land areas has experienced increased extreme precipitation, which heightens the risk of floodings, of course. Infectious disease spread and water contamination. Also in 2023, 48% of the global land area was affected by at least 1 month of extreme drought. The categorical connection between climate change and health has another unforeseen aspect. Greenhouse gas emissions from healthcare have increased by 36% since 2016, showing that health systems are increasingly unprepared to operate in a net zero emissions future and pushing healthcare further from its guiding principle of doing no harm. The growing accumulation of greenhouse gases in the atmosphere in general is pushing the world to a future of increasingly dangerous health hazards and reducing the chances of survival of vulnerable people all around the world. Of course, these data and conclusions are important, but even more important are the measures which must be taken to tackle these threats. Fortunately, in recent years, we have seen progress in this direction. In 2010, in Cancun, Mexico, COP16 launched the process for development of national adaptation plans aimed at reducing vulnerability to climate change and facilitate the integration of climate change adaptation into government and local policies and various programs. The planning of effective adaptation actions and measures that protect people's health is extremely important, so the assessment of health-related climate change risks and vulnerabilities is crucial. 2020 first in Glasgow, the COP26 made an important step forward. As a result of the health program, the world started actions to build climate-resilient health systems, with many countries and areas committing to these activities. The Alliance for Transformative Action on Climate and Health, ATTACH, led by World Health Organization, also plays a significant role in that. The big news came in December 2023, as 82 ATTACH members had already committed to build climate-resilient health systems through the COP26 health program. And this outcome was a remarkable move forward, including with a thought about big urban areas. As more than half of the world's population, 56%, live in cities, we can imagine how important urban policies are in protecting health against growing climate change risks. The good news is that the inhabitants of these cities realize, and 82% of the cities responding to questions on the topic answered that climate change is affecting their health. As we discuss in cities, it is important to underline the major role of urban green space. Increasing equal access to safe and well-designed urban green space can help reduce the negative health impacts of climate change. Unfortunately, in the period 2015-2023, the percentage of urban centers with at least moderate levels of green spaces has not increased and remains around 28%. Here we should underline how important it is to use nature-based solutions that address climate change and other environmental challenges by using and enhancing the capacity of natural ecosystems. They could be powerful tools for mitigating and adapting to climate change, as they provide a range of benefits that support sustainable development, including climate resilience, carbon capturing, and biodiversity conservation. Of course, the implementation of nature-based solutions nevertheless faces several challenges, particularly in low-income and middle-income countries, where there are difficulties in getting access to finding technical expertise and supportive policies. In many cases, local communities and indigenous peoples, who often have the most knowledge and experience in nature-based solutions, are excluded from the decision-making process and are not adequately compensated for their contributions or losses. So far, I talked about some positive trends over the past 10-15 years and the growing understanding of ordinary people and institutions about the obvious connections between climate change and human health. However, our optimism should not be excessive, because in the previous year only we have witnessed the rise of populist parties and movements, not just in Europe, and this may put under question our achievements so far. We have to be very cautious in this regard. Moreover, in a number of areas, responsible political elites must take the initiative from populists. Only an honest and responsible discussion can eliminate the fears of the people instilled by these new prophets of apocalypse. We have to admit that in some cases, these fears are not unfounded. Such a sensitive issue is fossil fuel energy, for example, and this debate is also active, very active in my country. After Putin's aggression in Ukraine, there was fear following the disruption of Russian gas supply chains. Within the EU, this issue was resolved successfully, although at a certain cost. But due to the ongoing war, it remains on the agenda. To keep energy affordable to local people, many governments decided to increase their fossil fuel subsidies. Nevertheless, in 2023, clean energy investment grew by 10% globally and exceeded investment in fossil fuel by 73%. Despite this, there are still significant regional disparities. Outside of what we know as the developed countries, clean energy investment is 38% lower than in fossil fuel. In emerging market and developing economies outside China, clean energy spending only accounted for 17.4% of the global total. And this tendency is concerning in countries where people's livelihoods depend on fossil fuel economy. In the end of 2022, the number of such employees reached 12 million people, which is a huge number of people. And this workforce cannot be sustained in the future, as our world is taking actions to leave behind fossil fuel energy due to its contribution to climate change and its catastrophic human impacts. Unfortunately, most countries remain ill-prepared for the vital transition to zero greenhouse gas emission economies, and we must admit that this will be a painful transition, as the risk is unequally distributed. The discussion on the topic of fossil fuels with populist party leaders and consequently with their supporters is highly problematic because of the above arguments. These people like Putin, these people hate the topic of climate change, relying on conspiracy theories, fake news, especially in their election campaigns. It seems to me that we have underestimated this danger for too long, and it is high time to oppose it decisively. It would be extremely irresponsible to the fate of humanity and to future generations to give up these achievements at such a crucial stage, as they are the fruit of so much perseverance and devotion of so many people. Thank you very much. Thank you, Chair.
Thank you very much. So I think at first we will get the impression about this process from the politicians, and afterwards we will listen to healthcare experts. So the floor goes to Mladen Ivanic, the former president of Bosnia.
Thank you very much. There is a saying who said, what is the issue on which any politician cannot have some sort of the answer? So we are the real proof that there is always the answer. I will not go in these very specific details like Peter did, because he very much took some of the data. I'm just trying to put some dilemmas which I have, and I hope that some of you also share my dilemmas. First dilemma is, are we really serious speaking about the climate change? And who is the driving force in fight against that? Too many cycles in that area. One example, 20 years ago, there was a big story of biodiesel, like a new source of the energy. Who can remember now the story about the biodiesel anymore? Then a few years ago, there was a story of electric cars, like a future in order to protect the environment. Just recently, we heard that Mercedes, Audi, and Volkswagen decided not to develop electric cars, but coming back to some sort of the hybrid engines.
Well, Chinese.
Why? Because they cannot compete with the Chinese. Will that have influence on the climate change? Of course it will. Will the Europe withdraw the intention to have a rule that only electric car can be registered because of economic interest? Probably yes. Where is this long-term policy? We will have a new American president in a few days. Everybody expects what will happen. I don't know what he will do. Maybe even he doesn't know what he will do, but we can expect very challenging decisions. If he will repeat the first mandate, there will be no money for the WHO. If we follow the first mandate, there will be no agreement about the climate change, carbon pollution, and all these things, because they withdraw also for some other agreements before in the first mandate. Can we expect that there is another guy who will have completely different approach? So I don't expect that. So what then to do? Who can finance, especially the poor countries, developing countries, in their adaptation to the new, let's say, measures in order to protect, the environment and not to have a climate change? Somebody told me, I don't know, is it correct, that there is some sort of the agreement that at least 100 billion annually has to be financed for the developing country in order just to keep the climate change under some sort of the control. If the US is withdrawing, who will be the leading agent? There is just one option. According to my opinion, this is the European Union. Is the European Union ready to take a lead in that? Do they have a capacity, leadership, ready to say, no, we have to continue in that direction? Or will the politicians in the European Union, like any other politicians, just think in a way how to be re-elected? If they will think in that way, Germany will reopen power plants based on the coal, which they closed. They did it. That they will continue that. It will be not just a case because of the urgent needs, because of the Ukraine. Where is the policy which is logical and some sort of the continuation in that direction? Honestly, I don't see that. Who is interested? Only academicians, nice guys from the NGO, all these guys who doesn't have a real influence, except using media to do it. I think that all of us, including our NGO, we have to be prepared for that, and we have to do as much as we can in order to create a public opinion that ignoring these issues is not acceptable. And I think that this will be the key in a few years to come. And I think that even the UN, everybody is very critical about the UN, but my personal opinion is that the UN is very efficient when it's dealing with the agencies who have a very specific, very well-defined areas with the clear structures. WHO, some other institutions, same way. That is the best part of the UN. And we have to continue to support these institutions, not to be thinking about inefficiency in big political discussions, Security Council. Let's see this better part of the UN, and let's try to support that. I just touched these areas, trying to share with you some sort of my dilemmas, how firm we are in fighting on these issues, climate change. I didn't touch health at all in my discussion, because this is even more difficult. Because if you think about the health in developing countries, they cannot develop the whole system without some sort of the support. Yes, there is a World Bank who is trying to support that. There are some other institutions, but without really strong additional funds, we cannot expect dramatic change in these areas. So this is completely new area, and there are more experts than me in that areas. But mainly, my main message is, I think that we have to be prepared for the time where will be no agreement like it looked that there was a few years ago. I think that we will have a lot of challenges with the new administration, with the lack of the leadership, with the politicians who are just interested to be re-elected, which means short-term decisions. I don't care what will happen with the globe 20 years when I'm already out of the game in all aspects, including these 65 years old guys, more than 65 years old. So thank you, Mr. President. I hope that it's enough to provoke little bit discussions.
Thank you very much. So I have spent 30 years. I have spent 30 years of my life in a hospital as an orthopedic surgeon and as a hospital manager. What I had to say, if people talk about the medical care institutions as dangerous, source of greenhouse emissions, gas emissions, I say, you don't know, the hospitals are working on electricity, basically. And it's nothing to do with some kind of, let's say, manufacturing or transportation, systems. It could be easily, the healthcare hospital had easily compared to a governmental office. The emissions are practically the same. The second point is maybe the transportation, rescue transportation, emergency transportation. And again, it's much, much less than any public transportation of any even small size city. So, because this is used only on emergencies. So I think that the climate change is inevitable, so we have to adapt to it. And the healthcare systems have to adapt to it. And there are two questions, If you look at the undeveloped world, and their healthcare systems, they need development. And then we have to answer the question, what are the development priorities? And the second question is, what are the adaptation measures to the climate change created healthcare problems? There are two main questions. And of course, what's the role of World Health Organization? So I'm very, excited to listen to the next speaker Maria Neira, Director in Environmental Climate Change and Health from World Health Organization. I hope you'll give at least couple of answers on these questions. The floor is yours.
Thank you, and thank for the little pressure on me, which I accepted with great honor. I have to say that I've been a public health officer for many years now, working in WHO, very proudly to work there. And I am convinced that public health is one of the best political agendas we have in our hands. I have enormous respect for the people represented in this table and all of you, because you have been on governments with real power, with real responsibility. And for me personally, is really a privilege to be able to exchange with you on this very open way that you are creating here for this dialogue. As a public health officer, and I'm being trained as a medical officer, I used to have this structure of before having a diagnosis, and then I suppose I shared this with you, we propose some prescriptions. And I will be very happy to move on the way of the healthy prescriptions that we can put on the table here. Clearly, the geopolitics have been very well defined here and described. It's a very challenging moment for all of us. And it's the time to hopefully bring this, the better part of the UN, as you were very well identifying. I think WHO can be this good part of the UN because we have very strong arguments, particularly for action. I think the diagnosis is there. You hear it very well. Whether it's in terms of climate change will be increasing infectious diseases, vector-borne diseases, waterborne diseases. There is no magic there. It's very easy to understand the linkages. There is another very clear linkage. If you pollute the air we breathe, then you will have problems if you in your lungs, you will have problems in the air, the rest of your body, and this air pollution will be resulting even on 7 million premature deaths every year. I think this figure is something that maybe we don't use very often, but I mean, we do use very often in WHO, but maybe we don't see it in the news, in the newspaper very often. 7 million premature deaths that the governments are assuming every year, plus all the chronic diseases that are resulting from this exposure to air pollution that is going to our hospitals, representing a huge cost for our hospitals, and of course, a huge cost for the patient itself, that they will reduce the quality of their life. Diagnosis is clear as well that this is affecting mental health. We will have cities that are now receiving these heat waves very often and affecting the most vulnerable people, whether there are the above 65 or very young people as well. But
don't mention it again.
no, I didn't even make any reference to that, but the heat waves will be affecting our population in our cities, and this is something that we need to face very quickly. And of course, all the issues related to the extreme weather events from Spain. Valencia has been now affected, and the suffering of these people will be perpetuated for a long time. So if we put all of this package, we have a very clear diagnosis on what it represents climate change for our health. Let's put it now the other way around. What are the prescriptions we can make now that we have such a clear diagnosis, and how the global health community can contribute to look at this populism or all of those arguments and perceptions and use the health argument as one of the most powerful ones to change things that needs to be changed using health. I remember years ago when I attended one of the COP meetings, we brought a big sculpture of lungs to the COP. And we put it in the middle of the COP in the health pavilion. And people were asking us, well, why are you bringing this? Why the lungs? They said, well, we want to make sure that people understand that this is a question of health as well. It's not just a question of politicians with a very short time agenda, or a question of the planet, yes, the planet, no, the polar bears, the different discussions. Remember that this is about your health right now, your lungs right now. And this is maybe an argument that can resonate on how to influence on a positive way our population, and telling them some critical facts. One fact, if we accelerate the transition to clean sources of energy, we can save more than 5 million deaths every year. And of course, the cost that this represents for the government in terms of the chronic diseases that you will avoid and the cost that is already paid by our hospitals. So the climate change is already representing an enormous cost for our governments that we are already paying no matter what. So if we accelerate this transition to clean sources of energy, the air pollution will be decreased dramatically and you will breathe cleaner air that will make you healthier instead of making you sick, as is the case now. If we accelerate the transition to sustainable sources of food production, consumption, and even waste management of the food we are sending to waste now every year, we will have an enormous benefit for our health as well, because we will have healthy diets and decrease all of this. So, and the third transition is in our urban planning. Yesterday, I have a fascinating meeting with the International Union of Architects. They want to associate with us much more. They are the ones defining now and designing the new buildings with energy efficiency, with better materials to make sure that we reduce the temperature in our cities, with more green spaces, and all of that, whether politicians will like it or not, those type of politicians that are not in favor of fighting climate change, this is happening already. And our citizens are more and more demanding, particularly when you use, again, the health argument. Now, what's happening in our hospitals? Of course, we need to adapt. Our health systems need to now cope with something that is happening no matter what. And that's why we are putting in place all of these measures to make our health system more resilient and be better prepared to cope with vector-borne diseases, better epidemiological surveillance systems, making sure that our electricity is, if possible, coming from sustainable sources of energy. And we are decarbonizing our health system as well. You were mentioning ATTACH, and I'm very pleased because this is a community of practice where we are exchanging around the world how to decarbonize and still provide a very high level cure for our patients, of course. So it's not at the price of the quality of care, but we can decarbonize and reduce this 5% of the global emissions that is coming from our health systems. And this is very motivating. And again, it's something that is irreversible now. Many medical doctors, nurses, public health community is now very engaged on this because it's very practical. And you see the benefits not only for the health of the people, but as well for the economy. You make a lot of savings once you put this in place, and it motivates a lot of people. So in the name of health, I think we can change completely all of this practice. And I'm very happy that at the COP29, so-called coalition, a continuity coalition of the presidents of the COP that have been putting health very high on the agenda has been created and continue. So I don't know whether I responded to your question, but I'm trying to put some very positive, strong arguments in the name of health, very much convinced that health is the argument, and I say the argument in capital letters, for more climate action, and the one that no populism or other, they cannot go around that because it's very much a strong one and very demonstrable one. So thank you all, and we will be very happy to keep pushing and promoting and demonstrating all of those health benefits that can be obtained by fighting climate change. Thank you.
Thank you very much. And we got another topic about the pollution is still relevant. Any kind of pollution, especially the air pollution, is relevant in big cities, and in urban areas. So we have to focus not only on climate emissions, but there are a lot of surrounding problems influencing the health of our population and influencing all the healthcare system. Thank you very much. Now I give the floor to Mahesh Mahalingam, Chief of Staff in UNAIDS.
Thank you, Mr. President, Your Excellencies. It's good to be back here to address you all. Last night at dinner, and I'm going to talk about an anecdote without the permission of the gentleman, but I hope he will definitely agree. I was sitting next to Prime Minister Muscat, and he looked at me and he said, you know what? People seem to have forgotten HIV. And he talked about how he and his wife sat down with his teenage daughters and talked about HIV. I wish there are more fathers and mothers like that still today. But his telling of the story was an important one. HIV/AIDS seems to have fallen off the radar of the leadership discussion, the political discussion, and more or less even within homes and families. And you're probably wondering, why am I talking about HIV in a session that talks about climate and HIV? And I'll come to that, because HIV is still a real problem. HIV hasn't gone away, as I talked about last year with some of you. There are 40 million people living with HIV. Every year, even today, there are 1.3 million new infections, and 630,000 people die of HIV every year. Since the beginning of the pandemic, 80 million people have been infected so far, and 40 million people have lost their lives. There is still no cure, and there is still no vaccine. Last night, there was a call to talk about optimism and not talk, being realistic, but also talk about optimism. So what's the good news about HIV? The good news about HIV is that of the 40 million people living with HIV today, 31 million people are on treatment. Today, treatment ensures that a person living with HIV has the same life expectancy as anybody without HIV. Treatment is also prevention. If you're on treatment and you are virally suppressed, you are not going to be spreading the infection to others. The same treatment taken as pre-exposure prophylaxis protects you from getting infections from others. So the science is there, and I'll talk about a very new development towards the end of my talk. Life expectancy has been reversed, and nearly $20 billion are being spent in low and middle income countries. So all that is good news. We believe, one of the few health issues that say we can end the AIDS epidemic by 2030. It's a target that we've agreed for the Sustainable Development Goals. And then comes along climate change. So before I explain what climate change does to HIV, I'd like to give special thanks to NGIC, who gave us a forum at COP29, and we put out a brief on the effects of climate change and HIV together with UNDP and NGIC at COP29. And I'll share the link with you all, but it gives you a telling story of how climate change has been ravaging the AIDS response as well. There are 7 ways in which climate change affects HIV. First of all, is the erosion of the public health infrastructure. Last month, I was in Malawi. A year back, Malawi was hit by Cyclone Freddy. And in the affected areas, nearly 12% of the population living in the cyclone-affected areas were living with HIV. Nearly 37,000 people were displaced and lost access to treatment. The same case in Mozambique, where there are floods and cyclones year after year, Zimbabwe. What do you think was the biggest concern of people living with HIV in those areas when the disaster struck? Any takers for that? What do you think was first and foremost on the minds of people living with HIV? Is it to take their possessions, their family photographs? It is to make sure that the bag that carries the treatment goes with them, because without treatment, they will quickly go from living a normal life to somebody who's infected. So when health systems are disrupted and access to treatment is you face death in a very, very short period of time if the systems are not established again. Second, a large amount of treatment delivery happens through community-based care. And when climate change related displacement happens, these systems crack, and they are very difficult to put back. The second direct effect of climate change is on increased prevalence of diseases that interact with HIV. Maria talked about some of them, whether they're waterborne diseases, whether they're vector-borne diseases. They hasten the progression of HIV to AIDS disease. And there's a lot of treatment failure. So the hard-earned gains that you have from treatment lead to people progressing to AIDS faster. And when you progress to AIDS faster and there's treatment failure, it also has a knock-on effect on new infections, because from previously being uninfectious, you become infectious again. So there's a knock-on effect on prevention either. Non-communicable disease, a lot has been talked about it. It affects people living with HIV even more because their immune systems are already compromised, and that hastens it. Pregnant women, a large number of pregnant women living with HIV have the dual burden of facing HIV, ensuring that they are on treatment not to pass on the infection to their children, and also face the disastrous effect of climate change on them. The third aspect is on food security. Many years ago, I lived in a country called Lesotho, a very interesting country that has only one neighbor and is landlocked, and every fourth person living with it in the country is infected with HIV, a prevalence of about 24%. When I was there, they faced, and they continue to face periodically afterward, there was a drought. We were trying to bring in treatment. We were trying to ensure that people are not falling off. There were Sundays were reserved for funerals in that country because there were so many people dying that they didn't have time to bury them. But the treatment was not sticking on because they didn't have good access to good food and nutrition. And why didn't they have good food and nutrition? A, because of climate change. Two, they were too weak to go out and plow the fields and get the produce. So there's a vicious cycle of food insecurity and HIV that spurs treatment failure. It also affects young people, and especially girls and adolescent girls and women. The ways we mitigate it is through food support and cash transfers, but these are very, very temporary. And as soon as they are taken away, the vulnerability decreases. The fourth way in which HIV is affected by climate change is through migration. The more there is migration, the more there are vulnerabilities to HIV, and the risk for HIV also increases. Treatment access is denied, social safety nets are broken, and HIV services are often difficult to get. The fifth one is looking at social determinants of health. And one might think we're stretching our luck too far with this, but it is very, very real. When you are displaced through climate change, the issues of gender, the issue of race, sexual orientation, childcare, all that come into force. I'm going to give you a non-climate change related example, but equally important, and it happens with climate change as well. I was born in Nepal and I lived there for most of my life. When the earthquake hit Nepal a few years ago, there was massive destruction. And people came out in the capital city of Kathmandu, they came out into a whole large open field where they set up camps for people displaced through the earthquakes. We worried about HIV, we managed that. But do you know what the communities, one special community actually came to us and asked for help? And that was the transgender community. What would the transgender community want from us? It was not treatment, it was not HIV prevention. It was access to toilets where they were not harassed and discriminated. And imagine in floods, in cyclones, in other areas, when displacement happens, we often forget the needs of gay people, transgender people, who might not conform to the basic structures of how you think life is organized. And toilets is just a very small aspect of the discrimination they face. It gets compounded when it comes to healthcare, when it comes to support, social security, etc. The sixth point I'm going to make is about financing. There was a lot of talk about fossil fuels here. In 2022, subsidies to fossil-driven companies was to the tune of $7 trillion. For HIV, we spend about 20 million per year. There is a deficit of $9 billion. But yet that $9 billion is very difficult to get. We all talked about January 20th in multiple occasions. The entire world's AIDS response, of the 20 billion that's spent in low and middle income countries, nearly $7 billion comes from the United States. And it's come through bipartisan support so far. But in the last 1.5 years, this program has not been extended for the usual 5 years that it used to be extended. We are facing prospects of the Mexico City policy that puts restrictions on how the money is to be spent. And they're shrinking ODA from Europe as well. The Global Fund for AIDS, TB, and malaria, 70% of the funding of the Global Fund, which is around $4 billion per year for AIDS, TB, and malaria and systems of health, goes to 50 countries that are climate vulnerable. So imagine how these investments are at risk year after year, and the prospect of reduced funding to health from the international community is at it. So the final point I want to make is about leadership and policy changes. And the one scientific development that I said I will talk about. There are policy changes that can be looked at, whether it, like during COVID-19, instead of giving monthly pills to people living with HIV, we started giving them 6-month dispensation of pills to help mitigate against emergencies. But there is a new drug on the horizon, and it's called lenacapavir. Lenacapavir is essentially a drug that is an injectable drug that you can take only twice a year, and you can be protected against HIV. We hope that in the coming years, a combination of lenacapavir with other drugs might lead to also an injectable, long-acting injectable that provides at least 6 to 1 year immunity, so that it becomes more like during COVID, where we took repeated jabs of vaccines. Why am I saying it? Because the price of lenacapavir in the United States is today $40,000. But our own research tells us that we can actually manufacture it for less than $40. So the manufacturing company which holds the patent has now given voluntary licenses to a few countries, including in Egypt and other parts of the world to manufacture. But we have to take them to scale, because if we don't take them to scale, we will repeatedly face issues around treatment access in different parts of the world. So I will end by saying one thing, which I think is obvious, is that health, climate change, they're all multi-sectoral issues. You cannot approach them from looking at just a hospital building and thinking, if we can fix this hospital building, we've solved everything else. It is directly connected with lives of people and communities and the way they lead their lives. Whether they're gay people, whether they're transgender, whether they're sex workers, look at loss of income of life, etc. So therefore, when we do address it, we need to do a multi-sectoral, whole of government, whole of society approach and factor health in equally as we look at other issues. Thank you very much, sir.
Thank you very much. Well, the message is very clear. It's not only a medical care problem, it's a social problem, especially in the places you have displaced persons, or let's say in places with natural disasters. So now we come back to the politicians. What are the political solutions? I give the floor to Rosen, Plevneliev, former president of Bulgaria.
Thank you, Mr. Chair. At NGAC, as a global organization, we are extremely proud of our strategic partnership with WHO. We listened very carefully when the Director General, Tedros Ghebreyesus, who is such a passionate fighter for humanism, for the most important for humanity, which is human health, is telling us. And that's why I believe, and I'm very grateful also to you, as you mentioned, we're putting it to the agenda and moving to the Global Baku Forum, where we will get heads of state and government, representatives from civil society, leaders from at least 80 countries in the world, 80 countries in the world. We will prepare today for important decisions to be taken in Baku in March. We're grateful to the experts, we're grateful to the European headquarters of UN, and we're having a plan. And our plan is not just to talk politically and not short, just explaining or playing certain situations, not being populistic. Our plan to be strategic and to bring solutions. The fact is very clear, not that I'm telling you, but it's what Tedros is telling us and the organization. Today, 37% of all deaths are related in one another way, human deaths, to climate change. 37%. That's what all the studies recently are telling us. Today, what all the studies are also telling us is that 13 million people per year are dying of climate-related issues. And this should be just the beginning. I remember the number of the Director General telling us it could go up to 100 million. Just imagine, 100 million people per year dying because of something we can probably address or we can probably prevent if we're a bit more smarter. So, of course, what needs to be done? That's why we're here, because NGOC is a different organization. It's not just the political talking. What to do? First of all, come back to COP29, which was very proudly hosted in Azerbaijan. If you remember very well, there is a deadline until April this year that all the countries in the world and the governments in the world should come up with their national determined goals about how to face the climate change. So we should put pressure on all of our countries we represent to do that. We need to have a long-term plan. Second, the simple things. For example, Mladen was talking about, are we serious? Mladen was giving examples. But just the simple things, even in Sarajevo, for example, or my capital, if I could share something that was really extremely successful, was that air pollution in our cities was really bad. But what do? It's not just talking about that. Educate civil society. How important is that? Make civil society to really control politicians, but also act. In my country, for example, it was civil society bringing measuring devices all over the capital and the big cities of Bulgaria. It was not the government. It was civil society organizing websites. Those websites were visited by millions of people per year and per day, probably, just to see what's the quality of air in their own cities. Then those people were putting pressure on their governments. You need to do something. Then those governments started buying electric buses, making new transportation solutions, making smart traffic lights, whatever. They started acting. And today, I have to say, there is a progress. There is a very serious progress. Speaking also about the vision, but also the mission of politicians being a moral compass. Yes, we do have a problem with President Trump, who is saying, I'm going to drill, and who is saying there is no virus, then the virus was a Chinese one, and so on. It's a long way of what populists can do to poison our countries and our democracies with manipulations and misinformation, and I should say mismanagement. But it is up to all of us to educate people. NGOC represents 80 countries, heads of state. We go to the TVs, we go to the public events, we go to universities, we tell them how important it is. We need to educate people about what every one of us can do to make an impact. And speaking about the energy transition, or speaking about transportation, or speaking about water management, or even virus prevention. Do you remember, as we met in New York, Anthony Fauci and his right hand, they were telling us, what do you choose from? Which is the biggest threat to humanity? Is it the nuclear bombs? It is a virus? Or it is artificial intelligence? Definitely it's the virus. Today, less than 20% from the viruses that could come and hit humanity, we know about them. They're still out there. We know nothing about them. And then you have a president of the United States just upcoming who's going to cut money, who doesn't believe in green transition. He says climate change is fake something. And on top of that, if you remember very well, that very same president was stealing the masks and the vaccines of poor countries for his own egoistic reasons. This is not a good news, but it's motivating us to do more. In each of the countries we represent, we need to do more. And here I should mention very good practices. For example, the European Union, even China. Well, today, if you look at the green transformation, which is so important for human health, as we were talking a lot on political levels, China was working hard. Today, 90% of all the materials and 80% of all materials, products, and technologies linked to green transformation are made in China. And now we have a very interesting point. For example, are we real, Mladen is saying, on green transformation? What about electric cars? First of all, the European Union did not take a decision to ban its ambitions on electric new car production. Second, even the German manufacturers agree that this very ambitious goal should not be abandoned. Third, there is no decision by the European Parliament, and there will not be such a decision to lift the ban. 2035, benzene, diesel is gone, and should stay like that. And we should fight in our own countries, with our own governments, with our representatives in the European Union about that. But more importantly, the European Union is a real example of a leadership in this green transformation that is linked to human health. And that is with our program Fit for 55, where everybody agrees and there is a consensus, and we're hitting the targets and we're working on that. So there is a long-term plan. But also we want to be net zero by 2050. And net zero means that you get that magic balance in each and every of the countries. Mladen was talking about the Germans digging back coal. Yes, but they pay for that. And that's another very important aspect of what politicians should do. You should create markets for carbon emissions. It's not just about measuring them. It's not just about complaining, oh, we are polluting. No, you have to make a market. Those who pollute, they need to pay for that. But those who don't, they can benefit from that. And that was Azerbaijan, COP29. We activated the global carbon market, where the poor countries can benefit and will benefit in the future. That is why there is a hope. Of course, there is a plan. There is no other plan but the SDGs. There is no other plan but Fit for 55 and net zero by 2050. No matter what the President of the United States should do and will do, we need to stick to that plan. And there is a great perspective, and I should say a great transformation ahead of us. We should be embracing it. And last but not least, from here, I should appeal to European policymakers, please don't make tariffs on cheap Chinese electric cars. It's not fair. It's really not fair. So if European producers were focusing on luxury, great. You want to get more money for your brands? Great. But you were sleeping when the Chinese were producing cheap and efficient electric car? That's your own problem, but don't stop it. Be honest. Because when cheap electric cars really reach the markets and ordinary people can benefit from that, we are going to gain a lot in human health too. So please, let's do our job. Thank you.
So we have made the first round of statements, and they were very different, and therefore they were complementary to each other, and that was the big success of our panel. Are there any questions from the audience or statements, please?
Question for Mrs. Neira. The first one is just out of curiosity. Whose fire which devastated such a big part of Canada last year, the Los Angeles fire today? I mean, their emissions, how are comparable with, say, the emission of all North America in 1 year? Is the fraction or is the equivalent of the year? First question. And the second one is not concerning global warming, but pollution. I mean, is the World Health Organization thinking and planning and doing something about what I see as an enormous problem in Ukraine, because you know that no European country makes TNT any longer, because making TNT is a very polluting industry. Only Poland is going on producing TNT. And if we consider that every year in Ukraine, more than 1 million shells of 155 or 152 are thrown on the other side, and every shell contains from 6.5 to 11 kilos of TNT. I'm wondering if we are going, and the Ukrainians will have enormous, dramatic health consequences after 3 years or 4 of war. Thank you very much.
The answer?
Well, I'm not sure I have a proper answer, but very challenging questions and very interesting one. Let me maybe start with the pollution and allow me to refer to something that I didn't mention before, but I need your support on this one. As I mentioned, we have every year 7 million premature deaths caused by air pollution. And air pollution is very much linked to climate change. I mean, the causes are overlapping. We have 75% of the fossil fuel combustion contributing to the climate change and contributing to air pollution. And this is where health is so important, because the citizens, as you rightly say, they will be very much concerned about air pollution. They will measure the levels, and they are now getting very much aware of that and putting pressure on politicians to take some measures on that. So where I need your help, sorry to divert, is that because at the end of March this year, 27th of March, in Cartagena in Colombia, we are having the second global conference on climate change and health, where we look as well at issues related to climate change, but we need a lot of political support on that, on ensuring that this conference will bring and accelerate all the interventions that we have identified in order to tackle the causes of air pollution and improving people's health. So your political support, your engagement, and your influence, as you say, you go to television, you can talk about sustainable transport policies in cities, you can talk about the role of healthy urban planning, the most sustainable food systems, and of course the transition to clean sources of energy. So in terms of pollution, we are very much concerned as well about other type of pollutions, like the one generated by war. And of course, there will be, in all wars, we always see after that, not only the direct impact of killing each other, but the secondary impact after that of the type of weapons that have been used. So WHO, we are not conducting exactly country by country what is the impact, but we are very much concerned about the consequences. And that's why our Director General is using this sentence very often that peace is the best medicine. So I think it's yet another strong argument to push and motivate for peaceful solutions and stopping the war, because only peace is the best medicine, no doubt. Regarding the fire in Canada and now in LA and all of that, what are the missions? Of course, from a health point of view, what is important is for how long you are exposed to pollution. So it's not the same to be exposed today to a very high level of pollution, but it will stay only for 3-4 days, compared with somebody who lives in New Delhi, to give a very clear example, and is exposed to a very high level of pollution almost permanently during the whole year. From a health point of view, we are very much concerned about this long-term exposure, rather than the acute will have different effects. In terms of lung cancer, for instance, you need to be exposed for a long time to a certain level of pollution. But of course, the consequences of this type of emissions are creating a problem in public health as well. There are acute effects, and then they are contributing to climate change. They are creating desertification and therefore more possibilities of other infectious diseases spread because of this desertification, changing the ecosystems and again, the biodiversity, so that the consequences on health are enormous and they can be medium and long term. And again, it goes to the need to the adaptation and being prepared in our cities. It's not normal that we are not preparing our cities to be resilient to the possibility of having floods, to have extreme weather events, and to have desertification that will accelerate or increase the probabilities of having this type of fire. So difficult questions, but definitely peace is the best medicine. And the pollution is a huge public health issue that we can afford and link it to climate change, but at the same time as a good argument to make sure that our population will be influencing politicians in a very strong way. Thank you.
Thank you. Daria?
So thank you. So I tried to be very brief. The first, my own background is that I'm a lawyer. So I'm not an expert in medical way side, but because the first 10 years of my own working time, I was a union lawyer, and that's why I come closer to the health situation of the workers, and we have advanced a lot since that time, but I think that almost every one of those steps forward were after the very, very long and not always nice discussions and debates how to do this. And then I think that when we are speaking about Europe, we normally speak about the European Union, and we think that we know how to do it. But I think that it has been also noticed that, for instance, COVID-19, where I had a very good experience to be with the Monti Commission. So we noticed also that we always think that something which is very dangerous happens somewhere else, not in my own yard. And that's why also some very, very simple things to remember, like washing your hands and keeping the distance and using sometimes isolations and all these things. We don't want to do those. And we noticed in Europe, for instance, that when they were people who were very fragile in this kind of the contacts, so easily people said that, but when I'm not that, why I should care? And then if they are counting also the expenses in business and all that, so it was very quickly, not only in USA, but also in Europe, those who said that I don't want to do anything because I can survive. And then those who were, how could I say, help their situation by isolating them from the society. And I'm very thankful you already, Mr. Mahalingam, you also took that it happens in almost in all healthcare that we try to use in that way, the easiest way. So, but I will say that what we noticed very clearly was that good, effective systems are not normally built in conflict time. You should do it in the time when you don't think that it's so necessary. You could think that which kind of the health structure is the best one, less expensive, and so on. And also to have brave enough to study afterwards where you made a mistake and then learn from that. And so I think that it could to give us also our homework. And you, my friend, also Zatlers, you should also somehow to create a system how you can a little bit check that we are doing our homework. And that's concerning the national health systems, that's concerning the meeting in March, the climate change and health. It's also concerning the situation where the World Health budgets, the public goods and so are doing. So that when we speak always that it should be the civil society's control. So we are part of that. And many of us, because we have been a long time in politics, luckily, the most of us, we have still a good reputation, and we can try to be effective help for the civil society. But I think that you made a very good panel. We have a lot of homework to do, and so I will say only that it's not only that we who are advanced and those who are still advancing. We noticed, of course, the difference in, for instance, I have been in Fukushima, that if you can plan the situation, you will get less human sufferings. But it's also so that, for instance, the people in Africa, sometimes they have prepared more for the epidemics, and they will also take it seriously, quickly, in difficult circumstances, what we did, for instance, in Europe or in USA. And I will finish by saying that really the trust in the society is something what we should prepare to increase all the time to work for the future, because there will be a lot of such kind of experts that my experience, and then everything what you will say by the science, and so they will say that doesn't matter. I have an experience, and putting them two things together is of course good, but giving also to knowledge and experience what you have. Thank you.
Thank you. Any more statements, sir? Anna?
First of all, it's a very general issue, and you will think, why do I highlight it? But I think it's very important that all of the interventions, and I will keep out Mrs. Neira because you are part of it, all of the interventions have highlighted the importance of United Nations constellation. I think that we are facing a moment where everything is malign and the United Nations is accused of everything. And I think it is important that we project this positive idea. Of course, United Nations is not perfect, but if United Nations did not exist, we should invent United Nations. That's and as I say, it's nothing. But I personally have been in so many panels where everybody on the panel was attacking and criticizing and highlighting the shortcomings of the United Nations. The second issue is, I was a bit surprised that you haven't elaborated on pandemics and about COVID, because HIV is a pandemic, but it's different kind. And maybe it would be interesting to listen a bit about, because again, WHO has been very criticized about COVID, yet it was there and it acted there. Now, my last comment, and on this I don't want, this is my position. I think that it's too simple to say, let's Chinese have the monopoly on EV, on accessible EVs. I think this is the tip of an iceberg that is much, much wider, especially for us in the European Union. So I just mark my disagreement with making such a cavalier statement on the EVs.
Statement on
EVs.
Questions, statements? The panelists?
Maybe just very quickly, because I agree that maybe I didn't emphasize the pandemics because I was focusing on climate change. My point is that if we tackle the causes of climate change, this can be the best ever barrier to prevent the potential spread of new infectious agents. If we protect our biodiversity, if we stop this war with nature, destroying the environment, polluting the air we breathe, the water we drink, the food we eat, all of our environment, we are creating as well a lot of probabilities for this barrier that exists between human health and animal health and environmental health that will be destroyed. So by reducing those barriers, obviously we are creating a better environment for future pandemics. By protecting the environmental health, by creating this One Health concept of being more conscious of the importance of avoiding this stream connection and breaking the barriers between animal health and human health, we will be better protected and we will reduce the probability of a spread of infectious disease, whether there is a virus or not. 30 million deaths are occurring every year because of environmental risk factors, something that can be prevented. And maybe I will go to your point. I mean, our health systems are very much focusing on health care. Only 3% of the resources of health expenditure is going to primary prevention. Maybe primary prevention should be paid, not by the health system, but should be paid by the Ministry of Energy, the Ministry of Transport, the Ministry of Industry, Ministry of Agriculture, because those are very good investments on primary prevention when you make, and you as previous meeting.
Do you allow me just to comment on this? Because I think this is
Switch on the mic.
this. I have an experience at the World Bank. And the other aspect of what you are saying is prevention, general health prevention. I remember when I was there one day discussing on a certain concrete country in Africa, where you had total, and this is approximate, $60 million for health. But of them, there was malaria, there was HIV/AIDS, and then all this was done by the Bill and Melinda Gates Foundation. And in the end, there was just 1 million, and everybody was trying to poach the doctors, the nurses for their projects. And the general health of the population is fundamental, and this is what, of course, Bretton Woods is there, but the World Health Organization, you are doing complementary comment on what you said, which I think is extremely important.
The floor is yours.
I don't want to be pessimistic, but I pose this question to you, or concern. Yesterday, we had a very good panel. All of them were great, but the one that I participated was on From Promises to Progress. And I can pose this to the climate change, because I remember, 20 years ago when I started public life, talking about the climate change. Today, we talk about, not today in this session, but these days we are talking about the climate change again. I remember in 2019 when, as a deputy prime minister, I was having meetings with all the Caribbean countries, and they were saying to me, for them, the climate change is not a matter of, concern, it's just a matter of survival. And yet, I don't think, if we are honest, if we do, index of what was promised so many times on the climate change and what was actually achieved. So maybe it's about time that we don't promise thousands of promises, but actually we promise 5 and we keep to those 5. And in this way, we will start regaining that public trust, because my fear is that with the populism, with the extremists rising all across Europe, talking just in Europe, but in other parts of the world, with a strain on the economies, my fear is that the climate change issues, which are very deep, as I said, survival issues, will just stay on the agenda, which could be good to maintain it on the agenda, but the results, I fear, are not going to be delivered to the potential and to the need that need to be delivered. And Mr. President, I have just one concern. I'm not so sure that the electric cars are less polluted to the environment, if we are talking from the environment point of view, than any other type of car. And I remember, and this is not politics, it's science, that there are serious concerns, not just how you produce the batteries, but how do you store them after their life. So that's it's been proven, at least those are the arguments of the science people, that they are much more dangerous to the environment than the nuclear waste, for example, where you need how to deal with it. Thank you.
Thank you. Any comments?
Just a minute. Yeah.
Okay, a lot of comments.
Just a minute on electric cars. But dear friends, just to look a bit about more the facts, what we are facing today. It's not just Chinese producing amazing, very efficient, cheap electric cars, but I don't know if you know, 20 Chinese cities, not 120, issued licenses for flying electric cars. Flying, not driving, that's already there. I mean, they're flying. So again, we should not close our eyes on where the future comes from. But on the other side, just also you need to know, hopefully you're following that it was South Korea, it was China, it was now also a bit of an American companies that are already introducing the so-called solid batteries. I mean, the solid batteries, they really solve, it is a game changer. It means that you can drive 1,000 kilometers and you can load it by 8 minutes, 8 minutes. Then the benzene and diesel is gone, it's just gone. Whatever you say, it's gone. And it's much quicker than you can imagine. And Samsung already introduced that 2 weeks ago, and environmental of solid batteries is not an issue at all. They don't have the lithium. Serbia, very bad news for Serbia. They don't need this, they don't need that. So anyhow, but to finalize on this, we are just in the beginning, and then comes the biggest oligarch on the planet, Elon Musk, and he will tell you, I'm gonna sell it for no dollar of profit, because the profits are not gonna come from just producing and selling the electric cars. So where are the profits going to come from? If he's gonna sell on zero, and that's what he intends to do. Let me ask you another question. Do you know that Mercedes quit its, just one more minute, its strategic partnership with Apple? So basically it quit. It doesn't want to use Apple anymore. Why is that? The Apple CarPlay. It's because Musk is right that the profits will be done by software, not by hardware anymore. And the way you move from point A to point B, you can fly, you can drive, you could be in a robotaxi. The profit will come not from the car itself, the wheels and the engines and the lithium inside. The profit will come from the service you're going to get when you're transported from point A, from point B. That means the software that runs, that makes the big data, that makes the cloud computing, where we, the Europeans, have been totally and completely sleeping and sleepwalking, and now we're waking up. But it's not too late. And I am very optimistic that we can catch up with a couple of delays. And that's why I'm preaching and praying. And it's not me. Actually, I was recently on the meeting of all the German producers, the owners of BMWs and Mercedes. They were telling what I'm telling you. I just listened from them. They were saying, don't sanction the Chinese, because we should not stop that revolution coming too. Thank you.
Thank you. Please.
I want to talk about a different type of tariffs. I'm calling them tariffs, but a different type of tariffs. And that's debt relief. One of the major things from the health sector that we need is investments in health. And for investments in health, countries have to step up. We know that the days of international assistance are slowly going to come to an end. But if you look at West and Central Africa, they are spending 7 times more on debt relief than on health. And if you look at the figures for countries that are most likely to be impacted by climate change, they are spending 2 to 3 times servicing debt than spending on health. So we need to find a solution where investments into health are possible by countries where we are saying we're no longer want to give them development assistance, or they have to fend for themselves. The fiscal space to invest in health is shrinking for many of these countries. It's virtually impossible. So we need to look at that as well as we look at different types of tariffs and protectionism and self-interest economically on different aspects. Thank you.
Mladen.
I would really like to be very optimistic like Rosen. I would really like to see all this going in that good direction. Believe me, I would be happy. But I'm not so sure that everything is going so well, so smoothly without the problems. Which country is the only one in Europe without the limits of the speed on the highways. Why? Why? Because of the car industry. I spoke with the manager of BMW who told me only in that case we will have image of the secure car, and this is the only way for us to send it. And they were against that. So are you really sure that if there is a difficulty, if they cannot compete, that they will not come back to the classical engines? Honestly, I'm not, because I think there are very clear evidences that this can happen. But again, I would be happy to be wrong. That means that the world is going in a good direction and that my perception of the political development are not so good. But I think that we are really faced with a lot of challenges. If there will be a tariffs, like Mr. Trump said, if the Europe will follow all these tariffs in the international trade, what is the essence of the free market? What is the essence of the modern democratic societies? Where we are going, in which direction? Protection by the key countries promoting the free trade. What is the essence of our society in the future? I think that we are really challenging we are faced with a lot of challenges, and I honestly believe I don't have the answers on that. I have dilemmas, but we have to think on that. I think much more deeper and much more serious than we think of these days. Sorry to be again a little bit pessimistic.
Please, please.
Thank you very much, Mr. President. I think one aspect that we haven't talked about in fighting climate change and its ramifications and impact on societies is education. We talked about health, we talked about policies and politics and all that kind of thing, but now how can we reduce the impact of pollution, air pollution, land pollution, water pollution, which are factors in spreading many illnesses in human societies. I think by reducing the volume of pollution in our societies, and that comes when we educate people to be considerate about the cleanness of their surroundings, of their cities, of their districts, of their whole life. So it is not only WHO's responsibility, but also UNESCO's responsibility and other institutions which deal with the issue of education. We have to introduce this in the schools, in the media, in the cultural forums, in the religious platforms also, where people will listen to educators, to lecturers, telling them how to be clean, how to be decent, how to be considerate about the cleanness of the environment. And this will reduce the volume of the pollution in our societies. Thank you, sir.
Thank you. So we have 3 minutes. I'm sorry. I want to wrap up the take-home messages, from this panel. The first message is very clear. Politicians must make health and healthcare as a priority policy, because it's about the human beings. The second point is we need a comprehensive approach. We cannot just say the climate change is the only problem for the healthcare and the health of the population. There are a lot of other things. Pollution is one of them. But I really want to launch another discussion about the war and military industry all over the world and armies all over the world. Nowadays, we know what is S-300 Russian ground-to-air or ground-to-ground missile, very often used in Ukraine. 1 hour of operation of this launching unit, not launching, but just operation of the launching unit, which is mobile, consumes 1,000-liter diesel fuel per hour. Is compared to the diesel cars in the cities, it's a huge amount. And already there was mentioned about the number of shells exploding, and burning oxygen and so on. and how much the fossil fuels are used in tanks, military wheels, aircrafts, and so on. And not only in wars, but also in exercising. You look at the parade and you look at the gas they really emit during the tank passing you by, then this is what really shocks you. So we have to understand that the war, or let's say military industry, creates pollution, soil, air, gas emissions, everything, minefields, mental, let's say, destruction of many people, involved. And it's not only about the military, it's also about the civilians all over the world. So, and chemical pollution, and you see blowing up one hydropower station dam, you have a lot of natural damage, and so I think we have to link the problems of war to our struggle for better future, for reducing the climate change and the gas impact on this climate change, and this is a comprehensive approach. We have to start to talk, and maybe let's say the discussions and negotiations for peace and arm reduction and many other things are most important, maybe most important than we just talking about electric cars or fossil fuel cars. And there is a social aspect. In any place, where there is a displaced person, so because of war or because of national disaster, you have all the bad things coming out from the social aspect. And then we come to the last point. We mentioned that taking care and tackling the problems of the social aspects, we need education. Absolutely. More educated the people are, less arrogant they are. And so I'm really grateful to all the participants, to the panelists. We are more or less on time, maybe 1 minute behind. So we have to be in a good discipline and with the good solutions. Thank you very much.